And the disc expert is here today, better known as Dr. Rod Campbell. Nice to see you, sir.
Thank you.
How are you?
I'm very good, thank you.
All right. We are going to talk about many different things, but the type of patients that you specialize in. He brought along a sponge today, and I thought he was going to clean the desk because it certainly needs it.
We'll get to that.
But no, it's for it's for something else. I love when you bring on. I always call them show and tells because these visual aids are so important and people understand things much better. And what you've brought this on before, and it shows sort of the progression of a disc, I don't know what kind of compressing or degenerating
collapsing.
or whatever, right? But yeah. So welcome, sir, and tell me what is type of patients that you specialize in, because different people have different kinds of back pain or spinal problems or things like that. So if you could kind of clarify that for us.
Yeah, the ideal patient is someone who has a disc problem, whether it's bulging, protruding, a degenerative disc condition, or stenosis. And usually people know they have that because they've already had an MRI, and usually at that point they've already been to a few doctors and they've tried some things. And if what they've tried hasn't worked, then they are in our sweet spot for what we can do to help them.
Okay. And you know, a lot of times when people who do have these types of problems, the whole sort of recourse of action by many different treatments is simply pain management.
Yeah.
And I think for most people, yeah, it's nice to get rid of the pain, but you're not going after the problem and looking at that and trying to fix that causes the pain, right?
Right. Here's kind of the way it kind of plays out here, Ken, is that a person will go to their doctor and the doctor will ask them, what's your problem? And then the patient explains what their pain is. And the doctor agrees, well, pain is a problem, so they start treating the pain. And when we only treat the pain and don't correct the problem, that's a mistake. And then the problem is allowed to continue and degenerate. As we see in our model here, we go from what we call a normal spine and down the road as it starts to degenerate and so forth. And one of the things we see here is here's the disc spacing in here, and it gets thinner and narrower, but also we see the advance of arthritis. That goes along. As the disc goes, so goes everything else. The disc becomes the most important thing to deal with. And we deal with that directly with our procedure in our office. Okay,
and if you would, if you could, I can see the top of this. If you could kind of tilt that so people can see the top, like the cutout, the cutaway. Oh, they fall off.
Yeah, they come right off.
Okay, good.
Okay, so this is the disc material in here, and this is normal.
Okay.
Let me get one that's really
here, I'll hold one.
Okay, so this is a normal disc. Looking at it from the slice view, we've got the internal part, the nucleus, and then the annulus right in here. And here we see a disc that's in trouble where there can be actually tearing of the annular fibers. That can be on their MRI report, where the disc begins to squeeze over to putting pressure on the nerve, and that's what causes the pain, is when the disc degenerates to this point. And it degenerates and collapses for a reason: it stopped working.
Okay. So you brought along a sponge here, but this is really a model. It's simulating a disc, right?
Yeah, you know, the thing about the sponge is we kind of have fun with this. You know, we spare no expense in our models and props here, but the disc works like a sponge, and there is a back and forth motion that takes place normally when the disc is healthy.
Okay.
And due to trauma, the disc stops going through this motion, and when it stops going through that motion, that's when the disc is no longer able to get the nutrients, oxygen, and that it needs, and then it starts to go downhill.
Okay, you mentioned trauma. Is some of this a cause that maybe somebody was an athlete and got hit a certain way, or you might be working in a garden at one time, you bend down a certain way, you know, pick up a bag of soil or something. Is that usually the cause for this, is because of trauma, as opposed to maybe it's hereditary, or could it be both?
You know, that's a good point, and we get asked that all the time. There is what's called normal aging, and the normal aging is a process that happens systemically with all the discs at the same rate and pace. The reason we know that trauma is involved is in some cases people, they know the trauma. In most cases they don't. But the key is this, is when we look at the MRI, which is the gold standard that shows us the disc itself, which is what we need to see in order to have a consultation with the patient, it shows us that, by golly, that one disc, or maybe two, is in really bad shape, different than the others. And the reason it's different is because at one point there was a trauma,
Okay.
and then that disc started to break down faster, quicker than all the others.
Okay, yeah, it's normal just by aging, like everything. Things kind of wear down a little bit, right?
It does, and then trauma exaggerates that and makes it go much, much faster until finally it breaks down to the point where when it touches onto that spinal cord, then they start to get symptoms.
Okay, so how do you go about healing this? Healing that affective disc and/or discs?
Well, we have a very different approach, and it's very unique because our emphasis is on educating the patient about how the disc works or its actual physiology. And a lot of times people, when they call in from a local community, they want me to tell them everything over the phone, and it literally takes me 20 minutes face-to-face to explain to the patient what we do, because we have to understand the physiology or how the disc actually works. And when we understand how the disc works, how it can break down, then we can simultaneously understand how the disc can be fixed. And then we get into our actual mechanics of our treatment method, which utilizes medical equipment and technology, which was invented by neurosurgeons and engineers over 20 years ago. And what we've done in our office is we have streamlined our protocols to get the best out of this medical equipment and technology. And it's very painless. There's no drug surgery injection. There's nothing difficult about it. People literally can fall asleep during the treatment. It's very comfortable to take, and there's no downtime, so it's very simple. But we have to have that time to explain to the patient how it actually works. And that's different than typically a patient goes into a doctor to have drugs, injections, or surgery, and there's really no discussion other than signing the waiver. But in our treatment, we want the patient, this is the most important time for me, the most fun I have is explaining to the patient things they never really realized about how their disc actually works.
Right. And as far as the procedure that you do, is it over a course of certain amount of time, or does that depends on the patient?
Yeah, it literally, it takes a period of months, and every patient that we have is there for the same reason. They have a bad disc.
Okay.
Whether it's in one area or another, or the neck or the low back, a disc is a disc and needs to be treated and repaired in the same way and fashion, and that's what we do for each patient, even though everybody's symptoms and situation is unique and different, and we hear that story when they first come in. But the treatment for the disc is treatment for the disc, and it does take a period of months to do that, and we explain why it takes that. Different than an injection where you may get some temporary results in the beginning. The difference with that is that with an injection, when we think about repairing the disc, any doctor you go to, you need to ask the doctor, is your procedure going to make my disc healthier? And injections were never intended to do that. So if it's not going to make my disc healthier, and there are risks, and it's dangerous because there are serious risks that are possible with an injection, it becomes risky, dangerous, and actually ineffective for treating the disc itself. So that is a mistake, and the standard of care for treating pain is not what you need to actually fix the disc.
Okay, so who then is a good candidate to receive your services?
You know, it's typically people who are in pain and it doesn't go away.
Okay.
And they've tried everything. They've been to the doctor, they've had physical therapy, they've had chiropractic, they've had acupuncture, they've had medications, narcotics, injections, and they may have even had surgery, because we do deal in certain cases with that situation, but nothing's worked.
Yeah.
And they're giving up, and they're thinking, what more can I do? And the answer in the standard of care industry is more drugs, injections, and surgery. That is our perfect patient. Those are the ones we help, the tough cases.
Are there ever a point in time, maybe a patient comes in, and I know you need to see their MRI, where you'll discover something that is, maybe they need something different?
Yeah. Well, this is why we take an MRI, is because if the MRI reveals some other condition, for example, if there's cancer of the spine, or if their situation is so far down the road that we have to be realistic about it, and explain that it may be too far gone in order for our treatment to help, or if they've had too many surgeries, then we're not going to be able to help that patient, and that involves having us get the proper diagnosis. That's why we need the MRI and to sit face to face with that patient.
Okay, if someone comes to see you, they don't have an MRI yet, they can at least consult with you, and then the next step is having them going to get an MRI, or do they need one just to come in?
Well, some people actually can't get an MRI if they have a pacemaker, a defibrillator,
okay.
or a
Interesting.
valve in their heart that precludes them from actually going under the MRI. In that case, we could have a CAT scan or an or an X-ray can be
Okay.
sufficient in those cases. And usually, the typical patient, they already have their MRI. They're already down the road on this thing.
Yeah.
We don't get people calling up saying, my back started hurting today, I'm in a little pain. We get the serious cases, they've already
Okay.
been down that road, so they usually have that.
All right, I want to give your website's very easy, thediscexpert.com, if you want to go there. And Rob's direct number is 949-702-4582. And I've been to your office before, and you've explained some things a little bit more in detail. And I really think that you can help folks out. And I love the sponge idea. But
Yes,
the
props.
visuals are very important, I think, for a lot of people.
Sure.
Whether you're using a sponge or using these models here, because you're explaining things in layman's terms. That's what people need to be reassured about what you're going to be doing. So I think that's very helpful. It's always good to see you.
You got it, thank you.
All right, you take care. And again, thediscexpert.com, there's the number on the screen. And if you think you might be a candidate for this, give Rob Campbell a call, because you never know, you may get some real help and get rid of that pain and the reason for it. So thanks again. Good to see you.
Okay.
We'll be right back.